Good morning, everyone. On behalf of the Centers for Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Services, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Erin Irvine. I work for Kaufman and Associates, and I'll be your moderator today. Today's webinar is titled Building a Dementia Training for First Responders. And the disclaimer, please note that this webinar series is supported by a contract awarded by the Centers of Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in this webinar are those of the presenters and do not necessarily represent the official position or policies of the Department of Health and Human Services or the Center of Medicaid and Medicare Services. And now I would like to turn it over to Jenny to introduce herself and our presenters for the day. Thank you.
Thank you, Erin. Hi, my name is Jenny Jones, and I am the planning coordinator for Aging and Long-Term Care of Eastern Washington. Little background for me is I grew up in a rural community, and I'm very passionate about doing work in rural communities, and then also working with tribal communities and building tribal partnerships. Go ahead, Tara.
Hello, everyone. My name is Tara Hill Matthews. I'm the Dementia Resource Catalyst at Aging and Long-Term Care of Eastern Washington. I use she, her pronouns. We're the area agency on aging in Eastern Washington, so for Mary Pondere Stevens, Spokane, and Whitman counties. My background is in healthcare training and instructional design, which I've been doing for about the last 10 years. And I will turn it over to Debbie, who we're lucky to have with us here today.
Hi, everyone. My name is Debbie Dodds. I am here today because I had a cancellation, so I'm not officially on the slides, but I did participate in the trainings. I'm a gerontologist. That means I study aging. I teach one class at UMass Boston in the School of Nursing for the gerontology department called Technology in Aging. And I also am a co-founder of a dementia app company where we got an award from the NIH and the Small Business Administration Innovation Research, SBIR grant. And probably most importantly is I cared for my mother for over a decade, and she lived in our home through the end of life. So very passionate about this.
So today is our Building a Dementia Training for First Responders presentation. First off, I wanted to thank Kaufman and Associates for working with us and helping us to create this presentation today. And I also wanted to thank the Centers for Medicare and Medicaid Services Division of Tribal Affairs for supporting this project. So thank you very much. Our objectives today is we're going to provide an overview of what the training covers, and then describe the process of completing the training through EMS Connect, and review the expansion of the training and the support for people living with dementia. And then at the end, we're going to discuss supporting and engaging tribal partnerships. And I am basing that off of, I will be doing that slide, and that is on different projects that I have worked on with the Kalispel tribe that I wanted to share. So for this overview and preview, we're going to show a video of the training that was used in the marketing and also was shown at the U.S. Aging Conference in Florida this year.
Well, good morning. We are going to be talking about working with aging populations.
We have our two agencies, Aging and Long-Term Care of Eastern Washington and Generation Connect.
I'm a gerontologist, teach gerontology in the School of Nursing.
I'm Bethany Osgood. I'm the Planning and Resource Director. I'm also one of you. I'm an EMT, firefighter, and lieutenant. We'll have Jenny Jones, and she's our planning coordinator. She does a lot of the long-term recovery for fires and disaster planning. Tara does all of our dementia training for professionals, for community disease.
We want to drill down quite a bit on how do we really understand dementia and talk about how do we work with people that have dementia.
Talking about how we transport the people that we work with and appropriate communication. Communication really is that key for first responders and healthcare providers when you're working with somebody with cognitive brain loss. Everybody has worked so hard over the last year to bring
this information to everybody taking this training.
So the training is essentially for first responders. It's 3 hours long and is accredited through the Commission on Accreditation for Pre-Hospital Continuing Education. That's what the CAPCE stands for. And it is found on the EMS Connect site, and Tara will eventually at some point during the presentation put the link in the chat. We do have a QR code. I'm not sure if that's available to her right now, but we will put the information in the chat on how to access the training. You do have to be a member to log in, so you have to create an account. It is $7. And the training is essentially tailored to pre-hospital providers like EMTs, and then also focuses on providers that provide services in rural areas. So this is specifically for rural communities and those providers. And then today we're going to cover some topics too around dementia. I really love this piece, and Tara does such a great job presenting this. But we'll be going through the changes that we go through as we age, which will be shocking because some stuff is part of aging, but dementia is definitely not part of aging. And Tara will be able to discuss this further. We will be talking about ageism, how that is on our society and how we treat others. Diseases that are common among older adults, the 10 warning signs of dementia, the most common types of dementia we'll address, the benefits of early detection. That is a very key piece in this disease, is early detection. And like I said, Tara will be exploring that a bit more with all of us. Identifying and addressing dementia behaviors, communicating with someone living with dementia, which is, again, a very strong piece to this, is how we can communicate with those that are living with dementia and treat them with the utmost respect that they deserve. And then tools for scene observation and response, and then working with care partners and families. All right, I'm going to hand this over to Tara, and she's going to start getting into the meat and potatoes of this training. Thank you all very much.
Great, thanks, Jenny. This is a training that we're really proud of. These are kind of just everything aligned together so that we could create it through EMS Connect. So I'm excited I want you to take a second to channel your inner first responder here, because I'm going to show you a few slides from the training. So these are directly from our first responder training. And this just gives you a taste of what it is, what the training is. So I'm gonna do this like I would the training in real life. Just to give you a fair warning, there is some interaction on the next few slides. So if you could use the chat or the question and answer section in the Zoom, like Erin showed us at the beginning, to put your responses in. All right, so here we go. We'll start with the first section, which is on aging in general. So this section has a few different things, and we'll start by talking about ageism. Ageism is something that affects a lot of people who are living with dementia. Not everyone who has dementia is an older adult, but most people who are living with dementia are older. Ageism it's talking about the stereotypes, which is how we think, the prejudice, which is how we feel, and the discrimination, which is how we act toward others or ourselves based on age. There are a lot of different types of ageism. We'll just be talking about two today. The first is implicit ageism. This is the ageism that sneaks up on you, that you're not aware that you have. And it includes unconscious bias that include attitudes, feelings, and behaviors toward people of other age groups. And it's unconscious, like it says on the slide. So it's something that we're not aware of in ourselves. Can anyone think of an example of implicit ageism? Yeah, Mark, I love that one. And that is a really common one, that older adults are bad at technology. That's an assumption that I've made before, that someone who's older than me is worse at technology than I am. So yeah, that's definitely one. Yeah, Maxwell speaking louder to older patients, definitely. Yeah, Lisa, that's a good one too. Maybe I think you're saying that someone who's older will end up in a nursing home. Actually, most people who are living with dementia do not end up in a nursing home. So thank you. I saw wrinkles as well. So if someone who's older has wrinkles. Yeah, Jenny, I'm just old and that's why I don't understand this. You can't teach an old dog new tricks is something that I hear pretty frequently. Yeah, Heidi, that's true. All older people have difficulty hearing. And sorry, I said that's true. I mean, it's not true. That is an example of implicit ageism. Yeah, Nancy, that's a good one. Asking an older adult if they're still working. Yeah, John making assumptions about an older adult's driving abilities. Yeah, Lori, older adults becoming asexual or non-sexual. So assuming that someone who's older isn't sexual, doesn't have sexual desire. Talking to them like a child. Yeah, these are great. You get it. We also have, yeah, assuming that they're physically weak. I love that one. I follow this great TikTok account called We Are Ageist. Excuse me. That has, hold on just a second. Great. Yeah, anyway, that account, We Are Ageist on TikTok, has a lot of older adults who are doing pretty impressive physical feats. So that's definitely an assumption too. Yeah, speaking to the older adult, not to the older adult, but to the younger person with them. Mark, I love that one. That is such a great resource. Thank you for including it. Yeah. Yeah, so all of those are examples of implicit ageism. And I have another one on the slide too. You can reveal that. Another one is expecting a younger person to be less skilled or capable. And I've noticed that a lot of the comments are about older adults, but ageism cuts both ways. It can also be an assumption based on how young someone is. Another type of ageism is the next one here. So benevolent ageism. This is something that I see a lot in the area agency on aging that I work at. And this one comes from a good place, right? This comes from a place of wanting to be helpful, to wanting to serve others. But it can be patronizing or paternalistic. So thinking that older people needed to be taken care of by younger people, that they cannot make their own decisions, that they need help when they may not necessarily need it. And a lot of people mentioned examples of this when we were talking about implicit ageism. And I think that's the one I have on the slide too. So talking to someone, raising your voice when you're talking to someone who's older, which I have also been guilty of. In fact, I'll be honest with you, I have a really memorable example from about a year ago. Before I started in this position, I'm part of a band. I play the saxophone in a band. And one person who's an older adult came to practice, and I was introducing myself to everyone. and I automatically raised my voice when I was talking to him. And man, the look that he gave me, he definitely did not need me to raise my voice when I talked to him. So that would be an example, speaking louder or slower to someone who's older. Does anyone have another example of benevolent ageism? And by the way, thank you so much for all of your responses. I appreciate you putting them in the chat. Yeah, Georgia, that can be a good example of offering your seat on the bus to someone who's older than you. I want to be clear about one thing, that sometimes that it can be a nice thing to do to try to do something like that, to offer your seat on the bus to someone who's older than you. But I would encourage all of us to check in with them before you do something like that. I should have checked with the person who I made an assumption about to see if they needed me to raise their voice. Observe. Yeah, Tammy, that's a good one. Using terms like sweetie or hun. Yeah, that's really common. Yeah, thanks everyone for your comments. All right, the next thing that we'll talk about, so just to kind of explain what else is in these slides before we go to the next one. This section is really about aging in general. So on the next slide, we'll see one of the other things that we talk about, which is the physical effects of aging. We have quite a few slides on the physical effects, but also the mental and emotional effects of aging. And credit where credit is due, all of these come from Debbie. So one thing that we talk about is mobility. This is something that affects a lot of older adults. So things like falling or stumbling or losing balance. Falls are the leading cause of fatal and non-fatal injuries for elders in the US. And on a similar note, every 11 seconds, an older adult is treated in the emergency room for a fall, and every 19 minutes, an older adult dies from a fall. There are a lot of things that go into that. So things are like physical things like arthritis or loss of bone density or loss of muscle mass can all affect this as well. And I want to acknowledge in the chat, Sweet, I hope I'm saying your name right, but some of the things are also cultural. And I want to say again that being kind or being helpful to someone who is an elder or an older adult isn't wrong. It's just a matter of checking in and making sure that it's something that is desirable. The next section that we'll talk about is understanding dementia. This is kind of just establishing a baseline on dementia. So in this section, we talk about the definition of dementia and how to explain the difference between Alzheimer's disease and dementia, which I'll explain right now. We don't have a slide on that, but Alzheimer's disease is just a type of dementia. So one is not worse than the other, it's just one type of dementia. We also talk about the warning signs of dementia and the symptoms. I've got a pop quiz for you. So again, using the chat and thinking about some of the symptoms of dementia, what are the warning signs of dementia? Yeah, forgetfulness. Yep, that is the first thing that a lot of people think of. Yeah, forgetting where you're at. Yep, so confusion with time or place. Yeah, I'm seeing a lot of memory loss and confusion. Having to use sticky notes for everything. Yeah. Yeah, so I'm gonna put that under this one right here. Oops. Well, all right, if you could go back one, Thomas, and you can take control back, it's okay. Gave you the answers. Thank you, appreciate it. Yeah, so having to use sticky notes for everything, I think that's kind of a sign in difficulty with completing familiar tasks. So those are the things that you know like the back of your hand, that you can no longer do, like getting home or being able to brush your teeth, things like that. Yeah, I'm seeing a lot of anger and frustration in the chat. So that can be changes in mood and personality. Some other things that I think a lot of people don't think about are, a couple of people mentioned this. Things like visual images can be difficult for someone with dementia. So that can look like tripping more often, not having as much spatial awareness, but also not seeing, not making sense of things that are the same color next to each other, like mashed potatoes on a white plate, for example. We didn't talk about challenges in planning or solving problems. Also misplacing things and losing the ability to retrace steps. I saw that in the chat, losing things. Also, difficulty with communication, especially verbal communication, and along the same lines, withdrawal from work or social activities. And then decreased or poor judgment is the last one. All right, on the next slide, we talked about all of the signs of dementia. Now we'll talk about the things that are normal aging. Just like our bodies change as we age, just like we need reading glasses and our hair gets gray and our joints change, our minds also change. So this is really to help answer, a lot of people ask me, I'm having difficulty remembering people's names. Do I have dementia? So this kind of answers that question. So for example, one sign of dementia is forgetfulness, memory loss that affects your daily life. But it is normal to sometimes forget names or appointments and then remember them later. I often forget people's names. I had an embarrassing moment last week where I forgot the name of someone I met a few weeks ago. So that's normal. The second one, challenges in planning or solving problems. It would be normal to sometimes make errors with math or finances. The third one, difficulty completing familiar tasks, is a sign of dementia, but it's normal to sometimes need help to record a TV show. Confusion with time or place is a sign of dementia, but it is normal to sometimes not be sure what day of the week it is, especially as we retire, or to think that it's Friday when it's actually Thursday, so that dreaded thing. It's a sign of dementia to have trouble understanding visual images and spatial relationships, but it's normal to have vision changes as we age, to need reading glasses, or to develop cataracts. New problems with words and speaking or writing are a sign of dementia, but it is normal to sometimes have trouble finding the right word. Misplacing things and losing the ability to retrace your steps is a sign of dementia, but it's normal to sometimes lose things and to find your keys in the freezer and figure out, oh, they got there because you were putting away the groceries. Decreased or poor judgment is a sign of dementia, but we all make bad decisions every once in a while. I'm telling on myself a lot today, but a few weeks ago, I went the wrong way down a one-way street because of some construction that was going on. So we all make mistakes sometimes. Withdrawal from work or social activities is a sign of dementia, but it is normal to sometimes feel uninterested in social events, want to cancel things. And then finally, changes in mood and personality are a sign of dementia, but it is normal to develop specific ways of doing things and then not like it when those are disrupted. The next section is more specifically working with people living with dementia. We're really talking about how to respond in a dementia crisis. So the first thing is to be calm, be patient, and be safe, the 3 Bs. So to stay calm, a lot of people living with dementia can sense your emotions. So it's important to stay calm if you're trying to create calm. The next is to be patient. The average time it takes someone living with dementia to respond is 20 seconds. So it's important to give a lot more space in the conversation than you're used to ask fewer questions and more short, single questions instead of multiple questions. And then be safe. It's important to make sure that you and other people in the area are safe. On the next slide, we have kind of a similar framework. So any behavior, one of the important things that we try to emphasize is that any behavior is communication. We just saw on a previous slide that one of the signs of dementia is losing verbal communication, having changes in communication. But so because of that, a lot of times people living with dementia communicate using a behavior instead. So anytime you see someone who is agitated or anxious or wandering, or even on the extreme side of the scale, more violent or aggressive, that's the first question you want to ask. What are they communicating? How are they feeling right now? Are they too hot? Is their sweater itchy? Are they hungry? Are they feeling overwhelmed? Things like that. The other things we talk about in this section are some barriers to the early detection of dementia, and a little bit about abuse and neglect and how to have a framework to resolve dementia behaviors. And then the final thing that we'll talk about on the next slide is communication. We have a whole section on communication to talk about things like what we just talked about, giving more space in the conversation. So we talk about, we'll start with the do not side. One of the most important things is to not test the client and not quiz or correct them. If you think about it, if someone told me, you're not where you are right now, you're in Colorado, unless you're in Colorado, what would your reaction be? You'd probably either be angry at the person for lying to you, or you would feel panic that something basic is not true that you thought you knew. So that's the surest way to cause anxiety in someone living with dementia, is to test or quiz or correct them. Also, I said this earlier, but you want to ask more closed-ended questions. And I know that that goes against what we are taught, but instead of saying, where do you want to talk? Maybe say something like, would you rather talk out on the porch or here in the living room? Also, you want to have shorter, more concise questions and give them more time to respond in the conversation. Also, during a crisis, it can be really helpful to emphasize that the person is safe. So to say something explicit like, you're okay right now, or I'm here to help you, or I'm on your side, something like that can be helpful. And then to allow the person who's with them, a trusted person, to assist with the medical assessment as well. It's okay to rely on a care partner or a family member to help with that medical assessment. All right. So that's all the slides we have from the actual training. We'll talk a little bit more about our process for creating training. So really the first step was to gather information and to find partners to do the training with. Unfortunately, the planning director who wrote a lot of the training, Bethany Osgood, isn't with our agency anymore. But we do have Debbie Dodds here. So do you want to talk about your process for creating the slides?
Sure, for finding partners.
And creating the content.
Yeah. So I would say that finding the partners was part of an effort that this Aging and Long-Term Care ALQ has done a great job of getting community partners involved. So we had a lot of people that were already on board with dementia because we have Tara as the dementia specialist working in the community. And to create the slides, we just did kind of an overall outline together. Bethany and I did. We talked about what dementia was, what it means to have. We dug in a little about aging and some of the different conditions and directions people will go with aging. And then we really spent a lot of time creating positive, strength-based ways to think about dementia and help people understand that the tragedy narrative, that sometimes the fear and stigma that's attached to it isn't necessarily the reality if you want to move in a more positive direction. So one of the ways that you can do that is through being able to understand that people with dementia still, what they will lose are things like their ability to think, to plan, to make decisions, but they still retain their ability to feel. So one of the ways, feel both good and bad emotions. So one of the easiest ways to work with people in a positive way is to help them stay in a positive mood. And that's especially true with first responders.
Yeah, great, thank you.
Yeah.
We were really lucky to have Debbie work on this with us. Like I said, she provided a lot of really valuable information on aging and on dementia.
Thanks, Tara.
Thanks for being here. Next we have, so the next part of the process after we got all the information gathered was to the instructional design process. So Jenny and I added some information and organized it and added some visual elements. Then we were also really lucky to work with EMS Connect. That's the platform that the training is on. And they were the ones who recorded and edited and basically created, refined the training. Also, it's worth pointing out that Dr. Travis Dirks at EMS Connect reviewed the training for medical accuracy as well. Then last was promotion. So Jenny talked at the beginning about the US Aging Conference. We also presented it at the statewide W4A conference, which is a gathering of area agencies on aging. And then we did a shortened version of it at the Northwest Rural Health Conference. These next few sections are really just what else we're doing around dementia as an agency. I'm going to go a little bit quickly through them, but I'm going to put my email address in the chat. Just if anyone has any questions, I'm happy to answer those. So the first thing that we'll talk about is our other professional trainings. So we do have the first responder training, but we also have a professional training series. We do those every month for some of our partner agencies and for home health care agencies. You'll see we also do caregiver workshops. So these are usually monthly presentations that we give to family caregivers on topics like dealing with behaviors or having a strength-based approach or supporting someone living with dementia over the holidays. We're also kind of always working on curriculum development. So for next year, we're working on dementia in falls and driving and transportation. So far this year, we've created one on self-care for care partners and the types and progression of dementia, as well as risk reduction. The other part of this that we're working on is through the Spokane Regional Dementia Friendly Community. This is a group that was started 6 years ago as the Spokane Action Team, Spokane Dementia Action Team. And we're the first group like this in Washington State. And we're really proud of the work that we're doing through this group of volunteers. Debbie is part of the Spokane Regional Dementia Friendly Community, one of the founding members, I recently learned. And we just have a great group of volunteers in our area working to make our area more inclusive and equitable for people living with dementia. Our dementia friends. So we've done quite a few dementia friends sessions. We have close to 400 now dementia friends in our chapter. And we did 40 sessions over the last quarter. If you want to go to the next slide, you can also see some of our initiatives. We're really excited about that first one, the memory garden. We just got news. Do you want to say the news?
Go ahead.
Okay. We just got a $60,000 grant. I use we generously. It's really Bob Scarfo and Debbie Dodds. We just got a $60,000 grant to make the memory garden a reality. So that will be in one of the biggest parks here in Spokane, Manitou Park. And we're so excited that this is getting off the ground. It's something that Bob and Debbie have been working on for a while.
Can I just
Yeah.
add that the memory garden is for people that have memory loss and their partner, and it's designed, it's probably about a half-acre design that way. Bob's a landscape architect and I'm a gerontologist, so it's a great way to use our public spaces. And it wasn't really a grant, I'll just say it was an allocation from our city council to our park department based on a lot of the work we submitted. Yeah.
Thanks for clarifying that.
Yeah.
So we're working on some other things too, but that's probably the highlight. On the next slide, we also have just a quick explanation of our dementia certification. This is for organizations and businesses, and there are two parts. There's a training for staff and then a built space walkthrough where we walk through their physical space and make recommendations to make it more inclusive for people living with dementia. So that's the work we've been doing, and I'll turn it back over to Jenny to talk about the next section.
Thank you, Tara. I appreciate that. So we're going to talk about supporting and engaging tribal partnerships. I'm going to start out with, I am by no means an expert, nor do I claim to be. Just to give you a little bit of background, I was married to a Northern Cheyenne tribal member, and so I have two daughters that are Northern Cheyenne and enrolled. And so this has just kind of been a part of my life, and part of my where I get my passion from is from, living in Montana and then being over here. And the community that I live in is a rural community that's next to the Kalispel tribe, and that's where I grew up. And so even though, I'm not a Kalispel tribal member, that was my community too, because that's where I grew up. And those were the families and the kids that I played with and that I was involved with. So this has just been some things that I have learned along the way by being an outsider and wanting to help and support tribal communities. I just wanted to share things that I've learned, and I think some of these can be difficult for others at times, but I always think first and foremost of remembering that all tribes are different and that I am here to help and be respectful and to listen. And those are the key things that I live by. And so anyway, these are just some things that I've learned. And I talked about listening. I think that's really important. It's not my place to have an input until it's my place to have an input. And then with that, being genuine, that being yourself and like truly having passion to do this kind of work is seen. And so when you come in and maybe potentially have an ulterior motive, or you have an idea, or you want something from a tribe, that is the wrong way to go about it. And honestly, I just don't even think that's an appropriate thing to do, or to even go in a direction like that, period, with anybody, as far as I'm concerned. And there needs to be an understanding that it's not about what you want, it's about what the tribe wants. And then respecting that sovereignty and understanding that this is about providing resources and services to their members and their community. So you can have a plan in your own mind of how you want things to go, but that's not the proper way to go about things. Build trust, and it's keeping your word. It's showing up when you say you're going to show up. Taking the time to listen and understand the culture and traditions. And then with that, when you go to another tribe, understanding that that's going to be different, right? And it's not the same. And respecting that and learning that. And you do a lot of that by listening, being quiet, and just taking it all in, right? And so these are just some things that I have learned along the way. And I love that in my position currently that I am still able to collaborate and work with our tribal partners and still be a part of the things that I'm really passionate about and want to be involved in. So this project right here, this isn't the EMS Connect, but I had worked for the Kalispel tribe for 13 years. Thank you, Aaron. I've worked for the Kalispel tribe for 15 years, 13 years. And one of the projects that I'm really proud of that we worked on, we had gotten a grant from the Empire Health Foundation, and we did this community event, and it was, or community project, and we called it Wolf. We invited everybody that we could think of to these meetings, and then we waited until we got the core group that stayed, and there was 4 of us. There was 4 of us that stayed, and we had tribal representation, we had clinic representation, tribal court representation, and then I, at the time, was the prevention specialist. And this, we did a writing program for the community where they could share stories. We did have guidelines that this wasn't an opportunity for people to be negative to each other or put names in it. But it ended up being so successful. And we got 30 stories, and we created a book. We put them all in a book, and people were aware of that. And that's what the Wolf book that has the Wolf acronym across the top. So it has all the stories in it. That is actually in the library in Cusick and on at the Kalispel Tribe Library as well. And then we created Little Wolf, which was a story about a wolf that lost its way, that left his group, and then he had an epiphany and came back to his pack, and he came back stronger and more healed. And we did this with the pictures was created by a Colville tribal member. We had so many people involved in this. This is just a really cool project, but this was intended to reach our 2-year-olds and up, that we could actually start talking about prevention at a younger age. And so we did this in English and in Salish. And I forgot to say that, but that's what the stories were about in the Wolf book, is it was about a healing journey or recovery from something. And so it addressed all different types of recovery and healing. And then the audio CD that you see there, that was done by students, and it's their voices, and they're sharing stories of recovery from bullying, dating violence, child sexual abuse. And we left everything confidential. So these are just some things that I'm uber proud of and that I was able to do with the Kalispel tribe. And we created this awesome community event and honored everybody. And it was just so positive and rewarding. And the fact that all these things are available in the library in Cusick and on the Kalispel Reservation that people can check out and look at, I just think is amazing. And I feel like, these things were able to happen by the previous slide that I talked about, by listening, being respectful, and doing the things that the tribe wanted to do in their way, and doing it right. So I just wanted to share that with you guys, and I really appreciate all of your time and being here with us today. And we are wrapping up. So I will mute myself and we can go on to the question and answer period.
So we have our first questions. You had mentioned a memory garden. Could you say more about what that is?
Yeah. The memory garden is designed, it's not a memorial garden. It's designed for the dyad, the pair of a caregiver and somebody that has memory loss. Nature's so healing, and being able to have inviting and safe place to go with your person that has memory loss if you're the caregiver, and let them wander a little farther, let them enjoy some of the smells, the sensory feelings that they had, and reminisce and just feel happy in nature. I will say that when we did the dementia-friendly community, we did a needs assessment for our Spokane regional area, or actually for the Spokane area. And one of the things that the community wanted were more resources for caregivers and people with dementia. And then also this helps with the park department fill their need through their desire for their guidelines to help people with have specific areas for people that are aging as well. So I hope that's helpful. There aren't very many of them. I think there's maybe a handful or a few more in the United States. So it's more of a new concept. And most of them, the ones that are available in the public space, are the newer concept, but many of these you'll find attached to memory care facilities or maybe a healing garden at a hospital. Anything else?
No, I think it's also one of the big things about it is that it's a respite for care partners as well.
Yeah.
So it's a place that a care partner, you described this so well in the thing you wrote for it, but the care partner can go with the person living with dementia. The person living with dementia can be in the garden, and it can offer some respite for the care partner.
Yeah. What I did with my mom.
Yeah.
Thank you.
Okay. Next question. What exactly is the built space report? It was shown on slide 30.
Yeah, thank you for asking that question. So the Build Space report is what we give to an organization who goes through the dementia certification. So we walk through their public space, whatever space they have for that faces the public, and we use a list of criteria that we've pulled from different sources, excuse me, and that we've run by caregivers and people living with dementia and we just provide recommendations at the end in the form of that report about things like the flooring, if it's even and accessible, or the noise level, the lighting level, the entryway, are the signs clear? Is it easy to get from point A to point B? Things like that.
Oh, we have another question that just came in. Could you say more about your plans to expand the training that you provided with us today?
Yeah, so right now, like Jenny said, it's on EMS Connect. It's on that platform. So I'm putting the link to that one more time in the chat, and our email in the chat, just in case you have more questions after this. So far we have given it to the statewide designated crisis response team. We've given kind of a modified version of the training to them. We're also planning to create a curriculum as part of the professional training series that I talked about earlier on dealing with an emergency. So using pieces of the emergency part in that as well. Anything else?
I don't think so.
Okay. Yeah, other than that, we're really just, oh, sorry.
Sorry, Tara. On a different note that doesn't have to do with dementia, we are in discussion with creating a training similar to this for providers around matter of balance and falls prevention. So that is something that we've been talking about and looking at doing in the future as well.
I was just gonna say that right now we're just mostly spreading the word about the training on EMS Connect.
Well, with that, I would like to thank Jenny, Tara, and Debbie for joining us today. In closing, I would like to remind everyone that today's webinar is recorded and that the audio and presentation slides will be made available online at cms.gov. Thank you again for joining today's webinar. Our session is now concluded. Have a great day.